Hi, I'm Dr. Sasson from Lighthouse Weight Loss. Interested in microdosing GLPs? Let's talk about it. What is microdosing? It's when you take a very low dose, lower than what is usually considered an effective dose, lower than what is reported in GLP clinical trials. For Tirzepatide, marketed as Mounjaro and Zepbound, that's 2.5 milligrams or lower. For Semaglutide, marketed as Ozempic and Wegovy, that's 0.25 milligrams or lower. Does microdosing work? Maybe. It's not known because there are no published studies on it, but I can tell you some of my patients do well on low doses. Let's take Tirzepatide for example. It's the best GLP and most of my patients are on it. Dosing starts at 2.5 milligrams and goes to a max of 15 milligrams. The 2.5 starting dose is intended to test if a patient can tolerate the GI side effects, which 95% of patients can. The inventor of Tirzepatide instructs patients to start at 2.5 milligrams and then increase or titrate their doses up to 5 milligrams and higher. Medical studies on Tirzepatide don't even report weight loss at 2.5 milligrams. They usually report it at 5, 10, and 15 milligrams. Here's what we do know from the medical literature that I think is relevant to microdosing. Weight loss results are dose dependent. People lose an average of 15% on 5 milligrams of Tirzepatide, 20% on 10 milligrams, and 21% on 15 milligrams. So what does that tell us? The more you take, the more it suppresses your appetite and the more weight loss you have. And that the benefits plateau at higher doses. Does that mean that there is still a dose-dependent response at doses below 5 milligrams? There's not medical literature on that, but I can tell you my clinical experience from my patients who microdose at 2.5 milligrams. This is not science, it's anecdotal, but here it is. About a third of my patients take the introductory test dose 2.5 milligrams, and they do well on it. I think that's because they are super responders. Here's what I mean. It is well known from GLP studies that patient responses vary quite a lot at any given dose. Some patients have great appetite suppression at lower doses. Some patients are sluggish responders and need higher doses. Let's take a look at the 5 milligram dose of Tirzepatide as an example. The average weight loss on 5 milligrams is 15% of total body weight, but some people will lose more, say 20%. Other people will lose less, say 10%, and it averages out to 15%. I think it therefore stands to reason that super responders can do well on microdoses. What about microdosing at even lower doses than the initial test dose? I don't know. I do have some patients who take lower doses at longer intervals, longer than 1 week apart, and they seem to do well. But I really don't have anyone who takes doses below 2.5 milligrams. If someone wanted to try that, I wouldn't be opposed. In fact, my treating philosophy is that you should take the lowest dose possible that gets you to your target weight loss, and then try tapering to see if you can maintain your weight loss at lower doses. Okay, that addresses weight loss. But what about the health benefits of GLPs at microdoses? Most people know that GLPs are incredible for weight loss, but a lot of people don't know about the remarkable health benefits. Those include a reduction in heart attacks, dementia, strokes, kidney disease, and improvements in hypertension, cholesterol, hemoglobin A1C, and inflammation. So, does microdosing work for these health benefits? Here the picture gets blurrier because the medical literature on this is limited and mixed. We know that some health benefits are dose dependent, like reductions in heart disease, cholesterol, and hypertension. However, some health benefits, like reductions in inflammation and improvements in insulin sensitivity, are still seen at low doses. Interesting, right? Some people who are passionate about longevity take GLPs at microdoses for this reason. I think that little is known about this. It's fascinating, and I look forward to seeing future literature on this. But in the meantime, if you want to microdose for health benefits beyond weight loss, I say go for it. The risks are so low. So let's review the advantages of microdosing. 1, it costs less. 2, for some people, it's all they need. If they are super responders or if their weight loss goals are less than the 15% of total body weight that's normally seen on 5 milligrams. For others, it's part of their long-term maintenance strategy. And for others, microdosing is less about losing weight and more about taking the edge off food cravings. And then for some, it's about longevity and health span. Okay, can a doctor prescribe a microdose? Yeah. It's off-label, meaning it's a dose outside the standard doses, but doctors are allowed to prescribe off-label. With Lighthouse, you control when you reorder, so our system is microdose friendly, and I'm certainly open to it. Well, I hope that helps. Dr. Sasson here. Be well.